Hello, my name is Patrick Whitehead. I'm author of Psychologizing, a personal practice-based approach to psychology, and your instructors asked me to record a little video for you coming back from this whole COVID-19 break from school. So what I wanted to do was talk a little bit about Chapter 12, Normal and the Psychopathological. I'm not going to reiterate anything that's already in that chapter, but I want to add some updated things to it. That book was the first one that I wrote, and I've written a few since then. And I've also written a lot of articles, many of them focusing on psychopathological issues and diagnostic criteria for mental health disorders. So I want to focus on a couple of new ones. The first thing that I want to point out is that it's impressive to take a look at the diagnostic manual if you haven't done so. So I have a copy of the 5th version, and it is really thick. This is almost 1,000 pages. The first one, keep in mind, was less than 200 pages and had only about 130 disorders. This has about over 300 disorders. So we keep adding to it every time we come up with a new edition. And sometimes we remove a few and add dozens more. So there are a lot of them. One of the criticisms that the 2013 version, the DSM-5, has had is that they've opened up diagnostic criteria, making it easier for you to be diagnosed with a disorder. For example, you used to only have to get, or used to have to get 6 different symptoms for attention deficit hyperactivity disorder in order to be diagnosed with it as an adult. Now you only need 5. So if you can imagine 10 years ago, if you had 5 of these symptoms, you would go see your doctor, and then they would say, well, you only have 5, so it's not a serious disorder yet. Well, then they removed the 6th one from it, and so now 5, those people would now qualify with the disorder. And then that sort of criticism has been to apply to a bunch of different diagnostic categories. Not to mention the sheer proliferation of disorders. So I think there are 11 or 12 different types of depression now that you can be diagnosed with. They all have their different categories. You can be diagnosed with multiple of them. And so what this does is means that nurses and providers and physicians can now diagnose someone for several disorders and write down their codes and get funding for it, and insurance companies can make sure people get the right drugs or whatever. Then there's the whole problem with the pharmaceutical industry. The former National Institute of Mental Health director criticized the American Psychiatric Association for being actually left the American Psychiatric Association, didn't want to be a part of it anymore. So National Institute of Mental Health is like, we don't want to be a part of the APA because of the relationship between pharmaceutical companies and the American Psychiatric Association. You can pull a variety of really embarrassing quotes about how the pharmaceutical companies pay for the luncheons at the APA conferences, and they fund research, and you wonder about the number one treatment modality for most psychological disorders being medicine, being that's called psychopharmacology, or getting pills for an issue, or some sort of psychosurgery. And then you think about, well, wait a minute, the pharmaceutical companies are funding a lot of the activities of the American Psychiatric Association. Do you think there's any sort of inappropriateness to that relationship? Perhaps, and the criticism's been made dozens of times. There are probably close to 100 books that have been written in the last 7 years about the DSM-5. But what I want to do today is take a look at attention deficit hyperactivity disorder to see whether or not we can understand this from a normal experiential or a personal sort of problem, and not necessarily a disease that somebody has. And so you think, I have ADHD the same kind of way that I have the flu or I have coronavirus, because there's tests for these things. You can get a flu test, you can get a coronavirus test. But there's no tests for ADHD, and there's no tests for the variety, the hundreds of psychological disorders in the DSM. So what does it mean to say that I have ADHD? So I want to take a look at that with you by focusing on some of these diagnostic criteria. So I've got the list in front of me. And remember, for adults or adolescents, older adolescents, you only need 5 of these. And so see if any of these sound familiar to you. Do you ever fidget or tap your hands or feet or squirm in your seat? I think about sometimes when I'm restless in bed, having trouble sleeping, this happens and I get itchy and I get uncomfortable, or if I'm having a really long conversation with somebody that I wish it would just end, and I start thinking for opportunities to escape, and my mind is sort of like not really listening to anything that they have to say, but I'm just thinking about like the next opportunity to like, all right, well, nice to talk to you. Better let you go. But then other times, I'm engrossed in what I'm doing. If I'm working on a new piece of music on the piano, or cooking something for dinner, or reading a really interesting book. So it's really context dependent, and I hope you can recognize that in yourself too. How about this? Do you often leave your seat in situations when remaining seated is expected? Think about, again, when I'm reading something, or I'm in my office talking to somebody, and I'm really uncomfortable with the conversation or where it's going, or I'm really bored. Again, or at a sports event that I find boring, or a concert that I don't really like, and so I suddenly just have to use the bathroom or go get something to eat or get something to drink. Again, depending on what it is I'm doing, I can sit for hours, or 10 minutes seems like a really long time. How about this? Do you often run about or climb in situations where it's inappropriate? That might seem a little extreme, but here's a caveat. In parentheses, they say, in adolescents or adults, it may just be limited to feeling restless. So we can say as symptom 3, do you ever feel restless? Which of course is already implied in symptoms 1 and 2. But there, if you say yes to one of the first 2, you already have at least 2, because the third one applies as well. Are you ever unable to play or engage in leisure activities quietly? Whenever I take a walk with my dogs, I like to talk to them and sing to them. That may not really be appropriate. I could do that in quiet. That one may apply to me as well. Are you often on the go as if driven by a motor? You should see me in the grocery store. I hate being there, especially when I have to worry about being infected with coronavirus. And so I'm zipping around and I can't wait behind anybody. And so if I look down an aisle and there's like 4 people there, I'll just take the next aisle and go all the way around and come back so as to avoid the traffic. That one applies to me as well. Do you ever talk excessively? Well, I haven't shut up since I've started this video. That one may apply as well. In class, do you ever blurt out the answer to a question? As a professor, I often answer a question before students have had adequate time to think about it because they start to pause and they're unsure. So I say, well, here's the answer. Do you ever have trouble waiting your turn, such as waiting in line? Well, I've had about 100 students in the last year complain about having to call registrar, call advising, call the bursar about funding and financial aid or registration. They're certainly having trouble waiting their turn. Do you ever interrupt or intrude on others, butt into conversations, butt into games or activities, or start using other people's things without asking, or not waiting for them to answer? And so this is a medical text, right? And so these are things that are being described to physicians and nurses and nurse practitioners and medical sociologists, or medical social workers. And they sound an awful lot like, a Tuesday in most people's lives. So does that mean that we have ADHD? Well, as I described in the chapter, The Normal and the Psychopathological, I don't think it's helpful to talk about this in terms of a disease or a disorder. We don't have ADHD. We can understand certain experiences as having difficulty focusing or having a lot of energy. But the energy itself or the lack of focus, those aren't necessarily problems except in those contexts. The same kind of restlessness is really helpful if the job that you're doing requires that you're focusing on a lot of different things and you're changing tasks regularly. If you're really good at focusing on one thing, and your job calls for you to be doing a lot of things, then what do you have? Like attention focus disorder, like you're focusing too much. So again, the context is really important to understand here. Now, I want to appreciate that some people may want to be able to focus in class and simply not be able to. In those examples, or in those cases, the person should be able to decide, hey, I need something to help me focus. I don't have a problem. I just want to focus more. My problem is I would rather focus more than I can. Notice what I'm doing is depathologizing attention deficit hyperactivity disorder. I'm not calling it a disorder at all. What I've called for in this video and in some of the other articles that I've written more recently, one on autism, one on post-concussion syndrome, and a lot of work in health psychology, what I try to do is discuss psychological disorders as problems of living. They're not diseases. They're not ailments or medical issues. They're not something that needs to be governed by a medical specialist at all. They're problems of living. They're problems with my relationship with my wife, relationships with my students and colleagues. They're problems with my own work ethic and what my expectations are. None of these things are diseases the way that coronavirus is, or an infection or a disease. They don't need medical attention, but they may need help. They may need some sort of facilitation by someone else, provided you want to go find that facilitation. Maybe it will require drugs. We have alcohol. Some states have marijuana. There are ways of, you can take sleeping pills, you can take anti-inflammatory medication, Tylenol, ibuprofen, things like that. We treat ourselves all the time. We don't necessarily need a medical specialist to step in and do that for us. And so that's one of the big things that I criticize in the American Psychiatric Association, the American Psychological Association, and psychological disorders in general. And it really is emphasized in the diagnostic manual. If you're interested in certain disorders, such as autism, it's really helpful to read what the diagnosis or the diagnostic criteria are in the DSM and think about them as a student of psychology. Are these really the same as has a fever, has a broken bone, has a tumor growing in a kidney? They're very different, but we discuss psychological disorders as if they're the same thing as like bodily diseases or medical diseases. So take a look at any of those disorders and see if you can't try to understand them in a personal way. Have you ever had these experiences? I think it's particularly insightful to do this with schizophrenia. There are 5 different domains, and each domain has like between 5 and 10 different symptoms. Read each one of those symptoms and see if you can't come up with an example in your own life that you've experienced this. And you can imagine a scenario where the repetitive experience of this would be really disorienting, and it would almost feel like your life is not real, or you're not participating in the real world, or you have trouble differentiating reality from fantasy, and that's terrifying. And then you get to understand a little bit about what schizophrenia must be like. Again, not a disease, but the inability to separate reality from fantasy, and one that sort of is debilitating to the person. It erodes their well-being. That's what I have for now. If you have any questions for me, feel free to email me at patrick.whitehead@asurams.edu. Good luck getting back into the online platform, and enjoy the rest of the spring and the summer.